Hi everybody. It's been a while since I've done a video, so sorry for the radio silence. Wanted to catch up today with some thank yous, some updates, and also a little bit about what's happening outside the world and how it might impact us. I first wanted to thank those of you who've been involved in the grants management process reengineering. I hear it's going really well, and I just want to thank especially those team leads who have helped to really both taking the time to describe what our current grant writing process is, but also really talking about where it should be. And as an organization that's currently 75% grant funded, this is obviously super important. So thanks to everybody for their help on that. I also want to let you know that there's more of that internal structural work coming for Metro Teenage, and Craven, who's now in his 8th week, and the directors are really looking to line up some future discussions about values, really wanting to make sure that we surface good value statements for the organization. They're going to be looking at meeting structure and also finalizing some roles and responsibilities. And these are all part of our continued effort to try to address many of the issues that came up in the retreat. So, really good communication, accountability, transparency, and professionalism. So, hopefully, we'll get moving on that. And then a little bit further down the road, are also include things like making sure that we start building that really robust onboarding and training system. I did want to talk a little bit about so a few positions that we still have open. We're still hiring for the finance position. We're still hiring for the prevention director position, but also for the we'll be opening a new fundraising position, and so keep an eye out for that. And I just wanted to take a minute to talk a little bit about healthcare reform because it's been an interesting learning process for me, and we have been doing some work around local healthcare reform. Partly, we're going to be impacted because as a small employer, 50 people or less, will be part of the health benefit exchange, and so it's going to be very interesting to see what happens as they build this new marketplace for small businesses. How we'll be affected is primarily around cost, and then what kind of plans will be available to us. So more information on that. But part of sitting at that table has really been trying to push the envelope of the discussion around health in healthcare reform. Much of the discussion is really about insurance and what's going to get covered and who's going to be in the exchange. And in Washington, D.C., we only have about 77% of people who don't have insurance. And we have been trying to be pretty consistent about raising the issue to say that in a city where we essentially functionally have healthcare reform already, we still have very poor healthcare utilization and not great outcomes. And so, really, how can we move the discussion forward in a way that really is about how do we make our community healthier? So that's been really interesting, and I expect that we'll continue to stay involved and really continue to advocate with a lot of colleague organizations around healthcare, around issues of HIV, but also just generally around kids and youth. Secondly, on a national level, there is a lot of conversation about what the impact of healthcare reform will be on HIV services in particular. Ryan White, the legislation that funds a lot of our HIV services, is due to be reapproved in September, and so there will be lots of discussions moving forward around what that should look like given healthcare reform environment. And then there's also a lot of talk about what's going to happen to our core prevention and other grants like that. So anyway, we will try to be as communicative as possible about things that are coming down the pike. I think the most important thing that I could say is that there's going to be tremendous pressure on us to be the highest performing organization we possibly can be, to really be able to measure the work that we do and really say with great clarity the difference that we're making in the lives of young people. And so asking for everybody's help, we're going to need to be able to identify and measure those. And we'll obviously be looking to the evaluation team to help us with that. But really, it's got to be all of our responsibility to say the difference that we're making in the lives of young people. And that's not just measuring numbers on a scale, but also being able to tell the stories of why our services are so important, how somebody is affected by being in a classroom with one of our great public allies, how somebody getting tested for chlamydia or gonorrhea is going to take different action in their lives, and how maybe a young person with HIV is feel supported enough and are taking different decisions about their health. So it's going to be quite a ride, but I know we can do it. We have a great team. These new positions are going to be really key for us to get there, but I feel secure that we really have a team that's going to help us get to our next best place. And the bottom line is really always, are we going to help kids? And I absolutely think that we can now, and I think we can do even better in the future. So thanks so much for your help, and thanks for watching the video.